All right, let's get right into it. We are talking about something that's a total game changer for healthcare, the digital doctor's assistant. In this explainer, we're going to break down how two really powerful pieces of tech, AI and a universal medical language called SNOMED CT, are teaming up to completely change how doctors make split-second, life-saving decisions. So it all boils down to this one simple question. Picture a doctor in a busy ER, just quickly jotting down some notes. How does that note, full of shorthand and medical speak, turn into a precise, life-saving diagnosis in just a few seconds? Well, that's exactly the puzzle we're going to solve. Now, to really get the solution, you first have to understand the problem. I like to call it the doctor's data dilemma. See, on one hand, you have these incredibly rich, but let's be honest, often messy clinical notes from doctors. And on the other hand, you have this desperate need for clean, structured data to make the absolute best decisions. And there's been this huge gap between the two. For years, people have tried to bridge that gap with something called a decision support system, or a DSS. You can think of it as a kind of co-pilot for doctors, but the old versions, they had a major flaw. They were rigid. They just followed these strict, pre-programmed rules. So if a doctor's note wasn't formatted exactly right, the system was basically useless. It just couldn't handle the chaos of real-world medicine.
But that is all changing, and it's thanks to this incredible new duo. I think of them as the code and the brain. These two technologies are what make a modern, actually intelligent decision support system possible.
So here's how they work together. It's pretty brilliant. On one side, you have the structured code. That's SNOMED CT. Think of it like the ultimate medical dictionary that turns every single symptom into a universal machine-readable code. But, codes by themselves don't have any context, and that's where the reasoning brain comes in, an advanced AI that can actually read a doctor's natural language, understand all the nuance, and connect the dots between those codes. So what exactly is this code? Well, SNOMED CT, it stands for a mouthful, Systematized Nomenclature of Medicine clinical terms. But here's the key part. It's a universal language. So whether a doctor in New York or New Delhi writes heart attack, SNOMED CT gives it the exact same digital code. It ensures computers everywhere are speaking the same medical language. And its partner in crime, an advanced AI model, let's call it a GPT-5 for our example, acts as the powerhouse that reads the doctor's notes. And it's not just looking for keywords. Nope. It's built to understand context, the subtleties, the relationship between different symptoms, just like a seasoned doctor would. It's the reasoning engine.
Okay, theory is great and all, but let's see how this actually plays out in a real, high-stakes situation. We're going to follow the journey from just a simple doctor's note all the way to a life-saving insight. It all starts right here. This is a totally typical note a doctor might quickly type up. Notice, it's just plain English, right? It's got abbreviations, like BP. It's short, but it is packed with critical information. This is our raw data.
And then, instantly, the system goes to work. The brain, our AI, reads that note and pulls out the key medical concepts. Then, the code, SNOMED CT, kicks in. Chest pain isn't just a phrase anymore. It becomes code 298570009. Hypertension becomes 3841003. Suddenly, every vital piece of that note is perfectly structured and universally understood by any computer system. So, we have the structured data. But data alone isn't really the goal, right? The next step, this is where the real magic happens. This is where we get a diagnosis in seconds. And this part is just so crucial. The AI isn't just translating words to codes. It's doing something much more advanced. It's reasoning. It's looking at the combination of these codes. Chest pain, pain shooting down the arm, a history of diabetes, high blood pressure. And it recognizes this isn't just a random list of issues. No, this is a classic high-risk pattern. And here is the result, delivered in plain English in just seconds. A clear warning. The system went from a messy, jotted-down note to a potential diagnosis of acute coronary syndrome. It turned scattered data into a single life-or-death insight. But it doesn't just stop there. It doesn't just sound the alarm and run. The system immediately gives the doctor a checklist of what to do next, based on proven medical guidelines. Get an ECG, now. Run these specific blood tests. Give aspirin. This isn't about replacing the doctor, it's about being the best assistant a doctor could ever hope for, especially in a crisis. So if we look at the whole architecture, it's this beautiful, seamless loop. A doctor types a note. The AI engine reads it. SNOMED maps it to universal codes. The reasoning engine spots the dangerous pattern. And then it delivers that critical alert right back to the doctor's screen when every second counts.
Okay, so let's zoom out from this one example. What does this all mean for the big picture? It means we are on the cusp of an era of much smarter and much safer healthcare.
So, why does this matter so much? Because we're finally getting the best of both worlds, the absolute precision of structured code and the contextual reasoning of an intelligent AI. This combo helps catch things a tired, overworked doctor might miss, making decisions safer for everyone. And because it's built on a universal standard, a patient's medical story can finally be understood across different hospitals, different countries, creating a truly connected healthcare system that's ready for the future.
So, think about what we just saw. We've bridged one of the biggest gaps in all of medicine, the one between human language and computer data. And that leads to one last big question. Now that AI can truly understand the language of doctors, what's the next frontier it's going to help us conquer?